Welcome to the podcast Below the Belt. Folks, we're having a challenge at our end, and we apologize to our guests and we apologize to you folks, but we are back live and we're not going to waste time. Welcome back to our guests, Volda and Lawrence. And Comrade Lawrence, I was asking you before we went, how are you preparing for Christmas at your end? I want to take it back from there because I don't know how much our viewers might have missed.
Okay. Thank you, Duncan, and thank you to the technicians for bringing us back live. To all of our viewers out there, a Merry Christmas and an awesome New Year's with God's blessing. Let me tell you, this is my favorite time of the year, and nothing stops me. I go all out. I don't spend much money, but I go all out. Right now, I'm preparing my pepper pot. I'm seasoning my meat for baking on Christmas Day, so that you can get it right into the gritty meaty so you can eat the bones and so on. And put in the final touches, as you said, I'm a girl with my things, so I just pull out all them containers and so on and take out my things and fix up my place nice, and I'm going to have a wonderful time once I wake up in this land of the living. I am going to have a wonderful time.
Awesome, awesome. We love this song of that because we know you know the economy. Oh, it's giving them some problems. The economy giving them some real problems. They promise economic dynamism and resiliency, but we're not seeing that, and a lot of people crying out. I think more of us got to do what Comrade Lawrence is saying. In spite of it, you have the best Christmas you can have.
That's right.
Fantastic, fantastic. Comrade Lawrence, we've missed you. Let me say on behalf of a grateful nation, former Minister of Health, former chairman of the People's National Congress Reform, is with us this afternoon, Volda and Lawrence. And guys, as you come into the podcast, as you start to listen, as you start to engage in discussion, won't you share that live stream for us? On behalf of the Guyanese people, Comrade Lawrence, we have missed you. So you're preparing for Christmas. What have you been up to? What have you been up to? We've missed you.
Lots of things. Um,
Tell us the things that you don't mind being printed in the papers because you know the fast.
let me just say that coming out of retirement, coming off of working is not easy for a workaholic. And
Mm-hmm. Mm-hmm.
so many times I found myself doing things that I did not do in a very long time. And among those things was sleeping. I slept a lot and still want to sleep more because then I realized how tired my body was. I was able to take care of some of my medical concerns, etc., that I had neglected um, during the time of work. And I have been able to spend more time with family and deal with more family issues. I've also been working with persons in various communities to set up what we'll call community classes for children out of school.
Mm-hmm.
And so I've been sponsoring those along with other family members and other members of the People's National Congress Reform. On a silent basis, we have about 8 classes running in Region 4 that we are supporting. And apart from that, I've been working with students from UG. I've been working with students earlier who were doing CX, etc. And my life has been very busy. Other than that, it has been party work in the last 2 months, I must say.
Mm-hmm.
Lots of party work to ensure that our 21st Biennial Congress was a success and that it was done in a transparent and accountable manner.
Nice, nice. And I would rather hazard to think the fact that we have not heard, and social medias be turned up loud, any accusations of anything untoward happening where that is concerned. You're very proud of the process as it turned out.
Oh, yes, certainly. And, this is God. I mean, for those who are believers, I want to say to you, this is nothing. What has transpired is nothing but God's inspiration, His love. And, He do answer prayers. There were a lot of prayers going up while there were a lot of negativity um, about the process and us being able to pull it off. And it helped us to recognize a lot of shortcomings which we have as a Guyanese people.
Indeed, indeed, indeed. You can't say that any better. But let's talk about some national issues because we have you all day. We call it Volda Thursday for a reason. We have you for a podcast, and then we got you in the ring tonight for the big fight. So we're just priming our listeners for what is to come later on. Let's talk about some things that have happened nationally. I mean, you've been behind healthcare here, and I don't think there's a Guyanese who would argue that we were on a positive trajectory in terms of beefing up our healthcare system. It was moving ahead in lots and lots of areas. Let's take, for instance, COVID-19. So I would hazard to think this was one of your signature projects, the what we call commonly the COVID Center at Liliendal. Oh, they ridiculed it in opposition, but now it seems to be the flagship.
Sharon, of all the things you do on your program, I love your laughter. I love your laughter. That
Oh.
laugh says so many things.
Uh,
And I want to give to those persons who had a lot of negative things to say out of ignorance. Out of ignorance. I want to give them today your laughter.
oh, you got me blushing up here.
Let me let me say
Go right
let
ahead.
me say, Sharon, and all of our viewers today. I personally believe when you are given the opportunity to serve, you have to give it your best shot. And you have to always remember that you are in the service of people.
Mm-hmm.
That's the first thing. The second thing you have to understand is that the money which you have the ability to spend must be done in a way that will be able to bring benefits to those people that you're serving, and not a one-off benefit, but it must be an investment that it can go on for generations who can build upon that, because we're a very young nation. We small, Sherrod, you would say we small, right?
Yep.
And so, whatever we do, we must do it in such a way that persons coming after us must be able to improve upon it, not break it down and build it over. They must be able to improve upon it. So, I can assure you and the nation and the world at large that the decision to build an infectious hospital, we didn't pull it out of a hat. It wasn't for the boys to make money. It came out of deep thinking coupled with the information and the data which we had and the history of the health sector in Guyana whenever there was an outbreak, um, and our inability to address it. If persons can remember, many years ago, we had the best hospital, which was specifically for people with whooping cough and so on. And that was a specialized hospital. We've always had specialized hospitals. We had the Ptolemy Reed Rehabilitation Center. It started off in Charlotte Street, and that was to deal with people with disabilities.
Mm-hmm. Mm-hmm.
And so after we had polio and all the other things that we had, and we have been able to overcome it as a world, we have been able to move away from those things because as science improve, we don't need to have it as a standalone institution anymore. Persons can find help at the health centers. One. However, infections are on the increase around the world.
Mm-hmm.
The WHO have been speaking about it ad nauseum, but persons have not been listening for one reason or the other. We could find all reasons to defend um, their positions. Persons have not been listening. The second thing WHO have been speaking to is the abuse of antibiotics all across the world. As you know, antibiotics should only be prescribed by a medical physician, and persons should only be able to acquire antibiotics. That is in the world. Antibiotics are sold at the street corner, just like cigarettes. And so persons have been self medicating
Mm-hmm.
and they have been abusing the antibiotics. So, having abused the use of antibiotics, whenever there is an outbreak, whenever there is a disease, whenever there is whatever illness there, application of antibiotics cannot work in the manner that it should have worked for what it was prepared for. And so that is why you're seeing all these large number of persons falling prey to these diseases because the body is so saturated that the antibiotic is not working as it ought to. Secondly, in terms of antibiotics, it has been some 20 years since we have had a new antibiotic on the market. So we got to understand where we're
Yep.
going.
Yep. Yep.
And so because we haven't had an improvement in antibiotics, we are very vulnerable. And many people don't understand how vulnerable we are.
Yep. Yep.
As a
Yep.
result of all of those things, if you check Guyana's medical history, you will see that through all of the infectious diseases that we have had in this country, we have not had a place specified to deal with infectious diseases. If you check our report, which was submitted to cabinet, so I know that this government have um, the opportunity to read that report, and I know that the present Minister of Health have had the opportunity to read that report because I left the exiting file on the desk for him or her who was taking over. And you would see that over the many, many years, we have been expending monies in not an accountable way. We have been extending monies whenever there is an issue. We refurbish a little place here and we use that for the time. And then when the infectious disease has been lulled, we move on. We leave that place. When
Mm-hmm.
another one
Mm-hmm.
comes up, we go to another place, we refurbish it. And that is what we have been doing, not recognizing that if we had taken all those money and put it into a facility, that we would have had a standalone facility to not only address infectious diseases in Guyana, which we have, but also to give assistance to our CARICOM brothers and sisters in the region.
Fantastic.
Coming out coming out of all of that and the projection in terms of where we were going, if we did not take some stringent steps to arrest the COVID-19 virus, we had projections where the staff of the ministry, the staff of PAHO, WHO, who's here to work with us, staff from the Guyana Defense Force, staff from the Ministry of Communities, UNICEF, UN, all the
Yep.
agencies
Yep.
that were involved in one way or the other in addressing this pandemic. We sat, we put the information together, and there was a projection that showed that if we did not take certain steps, we were going to have over 1,400 persons infected at one time who would need hospitalization. And mind you, our tertiary institution, the Georgetown Public Hospital Corporation, can only take 300 and a couple more persons.
Mm-hmm.
That's their maximum intake. Now, if we're going to have 1,400 plus persons who would need hospitalization, where is it we were going to put them? Where were we going to put them?
We could put
How
him.
were we going to
We could put
address
him at Jagdio
that
House because
situation?
he got a fire tail estate by the sea down there. We could put him. We could put him.
Yes, we may have had to commandeer that
Yep.
house, you know. But all in all, Comrade Duncan, what you see coming out of the Ministry of Health through the facility at Liliendal was based on facts, based on information, based on data.
Mm-hmm.
And I want to tell you this, while they always say that the king don't get the praise in his own kingdom. He always gets it other places.
Yep.
While we were beating up on each other's gynaes, and we're very good at that. We
Mm-hmm.
are so good at that.
Mm-hmm.
Other CARICOM ministers were looking to us
Mm-hmm.
as the example in this region.
They're looking to we know, I could tell you though.
They were looking to us as the example in this region in terms of how we were addressing the COVID pandemic.
Yep. And
We were talking to each other in the Caribbean. We were talking to each other across the Americas. Paho was, the person with the whip in their hands, and they were there for us and helping us along. We are among the very few countries in the Americas that was able in the pandemic to build an infectious disease hospital to address our issues. And so I don't care what anybody says. Nobody can take away the joy that I feel of having been involved with so many bright and young, competent young people in our health system to make that a reality. And so I want to thank my government for conceding to the Ministry of Public Health proposal to have that infectious disease hospital built. I want to thank the contractors, the consultants who were engaged and worked day and night to ensure that that facility became a reality before we end up in bigger problems.
yep. And
Because,
I,
go
I,
on.
I want to pick up on some issues very quickly there because that was not the only thing that you were doing. Quite recently, we saw a maternity wing of the Georgetown Public Hospital being recommissioned, and that whole project had its genesis since
2019.
2019. Since 2019, under your stewardship. There's another. If you go down into South Festival City Clinic, is now a huge, beautiful looking
Polyclinic.
polyclinic. I haven't gone on the inside
Polyclinic.
polyclinic, but like the shame to move in, Comrade Lawrence, like the shame to move in. So we had all that happening. My real question is whether you were. I mean, we know they would do nonsense. But whether you were surprised that they do so much nonsense, I took the numbers down for COVID-19. The day in which they took the reins of power, even though they were installed. I looked at it, I don't know why. Something said, Duncan, look at these numbers. They were 21 deaths and they were 474 confirmed cases. That is fact.
Correct.
They said we weren't testing. We weren't testing, so we didn't know the real thing. But the more they test, the more people dying. We now have over 1,000 plus deaths, and we know the confirmed cases are just under, if not surpassed 40,000. We were 474 confirmed cases. We are now close to 40,000. Were you surprised? Are you surprised by the level of incompetence?
Comrade Duncan, I don't think I was surprised as much as I was sad. I was so sad. I think that is what made me slept for very long hours during the day and then go back to sleep in the night. Like I didn't want to hear what was happening because I knew what was coming. I knew we would have ended up with over 1,000 deaths. I knew we would have ended up with more persons being infected. I knew we would have ended up having to impose draconian measures on our people because man of the foolishness. I have never seen anything like this. First, the PPP started off by saying I was making up COVID.
Mm-hmm.
I don't know if
Yep.
you can remember
Yep.
that,
Yep. Yep.
that
Yep.
I was making it
Yep.
up because we didn't want to have the elections and all sorts of story. Then they they told their people not to participate, don't listen to us, there was no COVID, etc., and so on. And then to see they took over and put their people at such high risk
Yep. Yep.
that even ministers were
Yep.
exposed to the COVID virus.
Yep.
I as a Guyanese, I felt so hurt. Second thing, Duncan, what they did is remove all the technical people from the positions which they had and place their persons who were not even qualified as those persons who were handling the matters. They harassed persons who were leading various aspects of the COVID um, response team. Remove them. I
Wow.
mean, it is
Wow.
beyond thinking what they
Wow.
have done. They decimated the health sector when they got in there, and I say that without fear of any contradiction.
And
That is what they did.
I remember you talking early on in our discussion here about, we weren't supposed to be talking so long about COVID, but we're talking about it, about talking with your partners and the stakeholders in the region. In this administration, and under this install regime, Dr. Krista Etienne of PAHO said to them, y'all got the Delta variant here. Frank was
Hmm.
embarrassed. He said, shame briefy. He didn't see the briefing notes and that. He wanted a report.
Oh, come on, come on,
This
come
is
on,
PAHO
come on,
telling you
come on.
that. PAHO is
Let me tell
impolitical.
you, Comrade Duncan, I have had the opportunity to serve as a representative of my country and that of the Caribbean region on PAHO and at the WHO level. And I can tell you the amount of information that comes to your um, emails that goes to your secretary, your assistant secretary, the CMO. Do we have a CMO in Guyana? If we do have one, well, that CMO will be receiving it too. And so many other directors in the health sector. And you have an office right here. We in Guyana, we are fortunate that we have a PAHO office
Yeah,
in Guyana.
yeah.
Not all countries are fortunate to have that. And I can tell you, PAHO worked people of Guyana as though they were being paid by the government. They worked beyond the call of duty. They were just a telephone call away. And so if you did not get anything, you can always call the resident rep here. And further than that, we have our regional reference lab, who is headed by Dr. Joy Sinclair, famous Barbadian CMO
Hmm.
um, in Trinidad and Tobago. And come on, we're supposed to be in contact with these people all the time. We have the Office of CARICOM here in Guyana, which
Yeah.
has a desk that is connected not only to the regional reference lab, but is connected to PAO, WHO, and everybody you can think about.
Hmm.
And so you get a vast basket of information coming to you.
Hmm.
But you see, when you upset the status quo, and you want to believe that you can do everything,
Yeah, yeah.
you end up in confusion.
Confusion powder.
Because, yes, you end up in confusion. It's like somebody throw confusion powder. Some people would say they throw some of the thing from the cat and some pepper, you know. So you end up with that type of confusion because the 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 structure for the confrontation of COVID-19 was as of such that each department each department within the Ministry of Public Health had a role to play. And there were persons who were assigned to the various roles, and there was a feed up mechanism
Mm-hmm.
to the minister's office, to the CMO. And so we were constant. Listen, you had to work 24/7, Duncan, if you wanted to protect your people. This
Mm-hmm.
was not no dress up story and no media, nothing. The media was very angry with me for not speaking to them urgent more. But I couldn't
Mm-hmm.
because you wanted to keep abreast of what was happening in country. You wanted to keep abreast of what was happening in the CARICOM region. You wanted to keep abreast of what was happening in um, the Americas, and also you want to know was happening with Suriname, what was happening with Brazil, what was happening with Venezuela, what was happening with Trinidad, because these were points where people were using to enter Guyana. And then don't let me tell you about our porous borders. And that is why we decentralized the whole operation. So each region ownership took ownership for protecting their people in the region.
Mm-hmm.
We were not afraid to allow the regional bodies, including the indigenous community, the two shows and so on, to take ownership. Because in taking ownership, we were training them for not just COVID-19, but any other thing to come. In, in other words, the Ministry of Health was training a cadre of persons across the length and breadth of this country who can become responders in the future to any other infectious disease or any other health matter which may arise.
Yep. And none of these guys is control freakism. And so we had Dr. Carissa Etienne telling us we got the Delta variant here. It took the Trinidadians to confirm it because it was a
Yes.
traveler from our country landed in Trinidad with the Delta variant, and they told us, well, the vexed when the Trinidadians tell me that Sputnik V wasn't approved by the WHO. They sent out Ram Sam even cuts down the Prime Minister in Trinidad.
But
This is the kind of thing we are dealing with. And then now they're saying that we have to operate as though we have the Omicron variant here. Again, they seem to have given up on testing. The borders are porous. They open up back the airports. They don't
yeah,
seem to make
it's
any big
all
kind
about
of testing,
economics.
partying
It's all
happening,
about economics.
football tournaments happening. It boggles
It's
the
all about
mind.
economics. And
Talk to
right now
us.
it's just about shopping.
Hmm.
You just walk into a place, you don't have to test. At least some of them have someone standing there to give you some sanitizer to sanitize your hand. But nobody is asking you anymore about COVID tests and all of that. I do agree that in certain circumstances we can relax um, some of the measures. But listen to me, if you're going to relax the measures, let it be part of the mandate that you're putting out. Don't let it be that people have to break the law to live.
Hmm.
Sit down, pull the various personnel from the various ministries involved. And so whether it's tourism, whether it's the Ministry of Finance, the Ministry of Trade, and so on, pull them together, Ministry of Labor, and so on, and get a good feel of what is happening around and how your measures are affecting these persons so that you can be able to put something in place that would, one, ease their burdens because we don't want people to go on the breadline. And secondly, let us see how we can be able at all times in easing those restrictions to protect our people. I don't know if you have realized, Duncan, that they stop even advertising the protocols.
Yep.
I don't know where
Yep.
the money is,
Yep.
but you're not hearing it on the radio and seeing it on the in the newspapers and so like before. So in Guyana, they ain't got no COVID, you know. There is no COVID. We happy as a lark.
Well,
Happy,
they're
happy,
surely
happy.
acting as though they don't have any COVID because, for instance, we picking up information in which they said they don't want any staff parties, they don't want any social because of COVID. And Ali went at Amazon Mall just last night in the Flame
Man,
restaurant, big party, big fete. They don't practice what they preach, and
that's right.
that is one of the most bizarre things. They come out talking about transparency, good governance, rule of law, but they ain't
Oh, please,
practicing them things at all.
please,
You know,
please.
and let's talk about how they have weaponized the courts. They have gone after you, Comrade Lawrence, about election fraud. 18 months
Yeah,
going on 2 years, nothing positive in the
that's
court because there is nothing to prove.
that's right. And you know, this matter is sub judice, and so I cannot say much about it. But I maintain to the Guyanese people and the world that I have done nothing wrong. Myself, neither Comrade Joseph, I can vouch for her because she has the same charges with me. Um, the difference is that she signed that document in the clear view of persons who are sitting ministers of this government, of all the elections officials, all the media, all the persons from the various organizations who came here to witness the elections, the Carter Center, the um, OAS, and everybody. They were there, but yet she's charged for the same thing. And you know, it is truly a waste of taxpayers' money. And at the end, everyone will see that it is just a waste of taxpayers' money. It is just one, perhaps it was one to tell me, you know, to go away from this politics thing, to shut me up or whatever. But I don't know how that will happen because, you know, every morning I wake up, God gives me life. And I am 58 years of age. I'm a Guyanese.
Lie,
I have
lie,
no
lie,
fear.
lie. You're not 58. Stop it. Stop it. Stop that.
I is the type of big girl who, when I see, I don't talk.
Uh-huh.
I will talk. So I don't know how they're going to shut me up, but we're going to see where this court case leads.
Comrade Lawrence, I don't want to pretend I didn't hear you say you were 58. Lie.
Yes, I am.
Lie.
Yes, I'm 58, but doctor, if you want to tell me I look
Good.
like 80, go right ahead and
That's
tell
why
me I
telling
will
you.
bash for the rest of the
That's why
day.
telling you. That's why telling you. You living in this economy. You not living in this economy. You not living in this 7% economy. No, 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 no. 58. Them people now you're seeing people collarbone showing all kind of worries.
Oh, no,
You look
don't
well.
talk about
You look well.
what the economy is doing to our people.
God is
Don't talk
good and
about
He's
it.
done you well. He's done you
Oh,
well.
he is,
He's
he
done you
is,
well.
he is,
You
he
know,
is, he
and
is.
so what we're seeing here is just bare nonsense. Again, weaponizing the courts against their political foes, no evidence whatsoever. Um, and while they're talking about rigging, look how they rigged the GCOM system to put a buy in. Oh, Father. These people are the real sanctimonious gangsters, Comrade Lawrence. Rigging the system every day. The commissions are supposed to be encouraging the safeguards and transparency and all of that, the checks and balances. They don't want to operationalize them. Why? Because they're rigging the system. And look what happened to GCOM right now. Huh? Comrade
Yeah.
Lawrence, how do we make sense of these things to the people of this country?
I believe that the opposition has to be more robust. I think there are many other things that we can do to deal with that. I believe that now that the People's National Congress reform have been able to settle this matter
Mhm,
on their leadership,
mhm.
that we'll see coming together of the opposition parties. And look, it doesn't matter whether you're in the coalition or in the partnership.
Mhm.
Once you're in a position in this country and you believe that you have something to fight for the people of Guyana, all opposition parties need to come together. I mean, what we're seeing here is beyond lawlessness,
Yep.
you know? And we
Yep.
have to really take this thing serious as a Guyanese people to ensure that we can let the government know that Guyana does not belongs to you alone. It belongs to all of us. And you have to manage it in the way that bring benefits to all Guyanese, those present and those to come. We have to raise our voices. We have to raise our voices. We got too many people talking in the closet.
Mm-hmm. Yep, yep, yep. And you know what? We love social media. We love social media. We love it. It enables us to do what we're doing now. As you said, when the program began, Comrade Lawrence, we couldn't do this in another time, but because of progress and development in information technology and all of that, we can come to folks around the world, like
Yeah,
this. But we got to move past social media activism as well and really and
that's right.
truly be boots on the ground. For lots of people, it's virtual
That's
boots on
right.
the ground, but we got to move
Yeah,
beyond that.
and the other thing I want to say to the Guyanese people, irrespective of where you are, look, stop this thing about America gonna do something for us and Canada gonna do something for us and the EU gonna do something for us. Those people, they have their own problems. We gotta do for ourselves. We have to do for ourselves as a Guyanese people, okay? And we have to understand that. There is no Uncle Biden coming.
Mm-hmm.
It is Guyanese and Guyanese and Guyanese. Whatever assistance we get, whatever allies we embrace, fine, we welcome them. But we have to understand that this fight is ours. It is ours.
Yep. And folks, on that note, I want to let you know that Comrade Volda Lawrence is going to be with us tonight in the ring, and we're going to be deepening our conversation then on the 21st Biennial Congress, which has just concluded. And we're also going to be talking a bit about the new dispensation of the PNCR, more substantive discussion on that. So don't believe we can get it into them things. Hold on for this evening. But thanks for joining us. Those of you who are now joining us, we're talking again with former Minister of Health and the former chairman of the People's National Congress Reform, Volda Ann Lawrence. We're privileged to have her today. Comrade Lawrence, 18 months in with this new installed regime, were you surprised? We should call this whole show, Were You Surprised? Were you surprised by the level of corruption? Just this morning, we featured a gentleman who resigned from an NDC because they wanted him to sign off on some works, 10, 13 million per month drainage work, of which he said he ain't seeing no drains being cleaned, so he's not signing off on anything. And he resigned. He resigned, and we got the Sharon Hicks affair. We know lots of them ministry people taking pays. Not only she, they taking pays. Just lots of instances where you can't prove it. Lots of other instances of corruption. Look what they want to do with the Natural Resource Fund, Comrade Lawrence. Were you surprised by any of it?
No, I'm not surprised, but I'm surprised at the depth to which this whole issue of pilfering and there's a lot of internal information being shared with specific companies and so on so that they can bid and win the bids. There are a lot of government officials who have established companies.
Mm-hmm.
And so that's why the money is not trickling down to the small man. That is why the
Correct.
money, that is what we got to talk about.
Correct.
That is what we have to talk
Correct.
about. So the money is not trickling down to the small contractors, etc.
Correct. And on that note, we were pointing out that the installer finale was literally begging the farmers and producers, those large scale ones, and those in big industries to let the money trickle down because they're giving them a lot of money. Friends and family pay back. You understand me? Nice time, but not meeting the people. Meeting the people, 7% taxable. taxable,
Mm-hmm.
7% taxable. That's what meeting the people. But the millions and
Yeah.
so on, no, 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 no. That ain't trickling down.
But,
You're absolutely right.
but Duncan, I don't know why we're surprised. I don't know why we're surprised. I bet someone very close to me that they would have gotten 5%. And then when the person starts, he said, "No man, oh man, they can't do that, man. We got I know." I say you might get a little two extra, or a little 1.5 extra.
The person
And
know the
so
jagabats. They know,
so
they
when
know
they
them.
got the 7, I called to cash in on my bet,
Mm-hmm.
right?
Mm-hmm.
I called to cash in on my bet, right? And but I must say to you that the PPP has always treated the public servants with disdain.
Mm-hmm.
Always. You know, I look at the 2 week salary for the medical staff, like if they're giving them something, like, oh, we just recognize these people have been working hard. When we left there, when I left office, we were negotiating with the Ministry of Finance, and I said that publicly
Mm-hmm. Mm-hmm.
18 months ago that the health workers were supposed to get 2 weeks tax-free pay for their work that they're doing re-COVID. I said it. I think we had some staff even picketing at the Georgetown Public Hospital Corporation for this 2 weeks money, and nothing came out of it. And so, they decided, "Oh, we're going to wait year in, and then we can give them, because the light goes spend. And the merchants got to sell off the
Mm-hmm.
products." So, so they come up and they give them this money when they're in that spending mood. And and our poor people, many of them will go out there and spend, 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 and then Christmas Day look at the things and ask why they bought them. And so I believe the responsibility lies with all of us, including you, to ensure that our people um, understand that this money is not for spending.
What do you say
They
to
didn't
them? What
expect
do you
it,
say to them?
and so they need to put up this money. This money is to put up. This money is not to spend. They didn't expect it. So if you didn't expect it, you didn't plan for it. So you need to put that money up, not spend it. The same thing with the army. I think today I heard on another program where persons was trying to highlight to them that what the APNU government did for the joint services was to increase their salaries, so that for the next 12 months, they will be getting a higher salary. And when they retire, it will redound to their pensions. They will get a higher pension, and they can be able to live a better life.
Mm-hmm. That seems to make sense. That seems to be a no-brainer.
Yes, but this is something that really, really gnaws at me. That they do it when people are, and I will keep saying it again, people are in the mood of spending. So they do it, it is wicked. you know,
Yeah,
it is
yeah,
very wicked,
yeah, yeah.
um, that they will seek to give them these monies at the end of the year. And so they go and they spend it and they buy all the nice things to make their house look nice and so on. And then next year is a struggle on that salary which they have. It is a struggle because when you put up all the fairy lights and so you better got the money to pay GPL come
But
January,
there's that too.
February,
There's that
you
too.
know,
There's that too.
your children will be going back out to school. You need to find school things.
That's another
You need to
discussion
find school things.
about no breaking in the trend of COVID-19. But this is school opening. Ready or not, here we come.
um, I don't, I don't, I'm not against the opening of school. What I'm against, Comrade Duncan, is that we are not hearing from the minister what is being put in place to protect the children.
Mhm.
What are the measures being put in place? That is what we should be hearing. And I want parents to get on the Facebook and ask those questions. How does the ministry intend, as far as possible, to protect their children while at school from contracting the COVID virus? And now it's not the COVID virus, it is all the spin offs.
Yep.
It is all the
Yep.
spin offs,
The
and that is
cousin and
what
the
we have to
nephew and
be
everything have
worried
COVID. Yep.
about, because we have seen when the infectious hospital ICU is overrun, we have seen the high amount of deaths.
Correct.
And I always say to
Correct.
people that I have been there and I know we don't have that amount of emergency staff. I know we don't have that amount of ICU staff that we can share between our tertiary institution, the GPHC, and the infectious hospital. We are working people to death and they are tired. And so sometimes when I see the lash that people put on them, and say all sorts of things, it hurts, because I know that those staff are going beyond the call of duty. But they are not Rumpelstiltskin. They can't spin straw into gold. They need the equipment. And I keep asking, where are the Cuban brigade that we were told came to this country to help with the COVID infection? What are the categories of persons that came? Were there emergency nurses? Were there ICU nurses and doctors? What are their specialties? Don't tell me that we get a brigade. I want to know what makes up that brigade. That is what I want to know. Because if you bring people to just assist the few staff that we have here, baby, we playing three-card game. We playing three-card game.
We
So
gambling
I
with the
want to
lives of the
ask
people
the
in this
Guyanese
country.
public, don't beat up on the doctors there. Don't beat up on the nurses there or the attendants and so on. Those ambulance drivers and so. Don't beat up on them. Beat up on the authorities that will prefer to take our money and buy Sputnik vaccines
From the shady sheep.
that have not been approved by the World Health
Yep.
Organization.
From the shady sheep.
And not only that they buy it one time, not only did they buy it two times, and what Frank must tell us now is how many Sputnik vaccines are remaining that are expired. That is what we must know. We must know that. We must know how they're wasting the public money when they could have employed all the other countries employing people and bringing in people and paying them so that they can take care of their people. But this Minister of Health seems to believe that the people of Guyana are like fowls and ducks. So when they die and say, you don't worry, you just dig a hole and throw them in, or throw them in the latrine or something like that.
Well, Papa Jagabat, he said it very callously. He said people will die. Why says he wrong? Said the people. Why says he wrong? Said the people dying.
You have a leader that's saying that
people will die.
And nobody's hauling him over the coast. But if Volda Lawrence had said that, they would have been all over me, right? I would expect my leader to say that despite the possibility exists that people will die, we will do everything to ensure that that doesn't happen.
Money got make.
That is what
Do everything.
I want to hear.
Money got make, Comrade Lawrence. Do everything. Money got make for them boys.
Well, that's the whole thing. And Guyanese got to stop talking in little corners and whispering and have to stand up and speak out. They're going to knock you off anyhow if they want to knock you off. They don't care how good you're good. They're going to knock you off. So we have to understand that.
Yep.
You know? We have to understand that. It is sad, but it is a reality.
Well, I hope our listeners would have recognized that even though we've had a false start today, we give them back the time because we know these people, it's the thing free, and the fight, we've given you back, people, your time. Those of you who Those of you who are now tuning into the podcast below the belt, welcome. Ensure that you guys share the live stream. It has been our privilege and an education having the one and only Volda and Lawrence with us, former Minister of Health and also the former chairman of the People's National Congress Reform, the PNCR. And we've called it Volda Thursday for a reason because we are privileged. Folks, it's Christmas, you know. And Comrade Lawrence giving us we Christmas one time. We have her for lunch and we have her for dinner as well. She's going to be in the ring tonight, folks. And we're going to be talking this evening more and more about the now that it is in the rearview mirror, the PNCR 21st Biennial Delegates Congress that passed just last weekend, and this new dispensation with this new cadre of leaders or expectations and all of that. But as we ease into that discussion, I know some of y'all fast, but let me tell you something. I host the program and I fast too. It's all of me. It's all of me. So I want to know, Comrade Lawrence, you are a tactician, you're a strategist, you are, I
Really?
think, a politician extraordinaire in my humble estimation. That being said, you know, they say that a day in politics is like a year. 2 years out, I would have said hands down, Volda and Lawrence is the next leader of the PNCR. 2 years out. But a day in politics is like a year. You know, you have surprised us. And I am certain you will go on, keep surprising us. You took a step back. I saw one report said that you decided not to run for your own personal reasons. Talk to us about um, understanding the time and how you decided you are not going to step up in this round here. You've been working hard. You've been a leader in the PNCR. You're going to step back a little bit in this season.
Um, Duncan, there are so many things, many of which I will not say here on
Mhm.
this program. It's personal to me.
And and
And
and some is for the book too.
some
Some for
for
the
the
book
book.
too. Some for the book.
Let me just say that I believe that as a politician, you must be able to read the dynamics on the ground.
Mhm.
You must be able to read the people. You must be able to read what is happening around you and around the world. I believe personally that the tax on me, so many, I could remember at Ministry of Health,
Mhm.
I couldn't sneeze.
Mhm.
Some reporter was on me. They always carrying what I say in a different way, reporting out of context. And then there was the attack when I was in the political arena leading up to the elections. I don't know if people were taking notes,
Mhm.
but I have all those clippings. I like to keep my files.
Mhm.
Everything I said was an issue. I One day I said that when Priya was the Ministry of Education, and she would get the the results for the common entrance, and so she used to get a little bit results, like when the man go and buy a book, man. And by the evening, Dharam Lal had it all over, and our Guyanese people jump on it.
Mhm.
Oh, I'm on
Mhm.
the I attacking the indigenous people. Hello,
Mhm.
y'all look at me and look at me good.
The same fella that attacking the Court of
Will
Appeal
I be attacking
justices.
myself?
The same
No, but
fella.
will I be attacking myself and my own family?
Yeah.
Huh? Will I be attacking my own mother?
Mhm.
I mean, come on. All we know, we saw a little quarter of a quarter
Mhm.
of that.
Mhm.
So, but here it is, and so many of our people were so gullible, they jump on it and they went on, and so that was one. Then the next thing was when I said to people at the Kitty Market Square that you need to follow those ballot boxes, and my words,
Oh
hey,
yes. Oh yes.
my words.
Oh
I said
yes.
you need to follow those ballot
Yep. Yep.
boxes and ensure that when they put them in the container that you put your lock on too. I told our people that. And that became a big international thing. You
Mhm.
would not
Mhm.
believe how many of
Night
the
shift.
observers came to talk to me about this statement. And I was very upset. And I must tell you, I didn't handle some of them nicely. I took off my gloves for them
Mhm.
because this is my country. I have been involved in elections for many, many years, and I know what happens. I know what happens with these people that we got to deal with. They like to play their Sunday school teacher, but their Sunday school teacher. Everything they call somebody, that is what they are.
Yep.
But they like to turn the clothes
Yep.
outside, inside out,
Yep.
and put the stain on other people. And, there were so
Hello? Nobody don't call me now. Don't call me now, please. I'm begging y'all. The story now sweet.
yes,
Go right ahead, Comrade Lawrence.
yes. Then there were a few of the newspapers here, especially Stabrook News, who was very vicious to me, very vicious to me.
Wow.
But I laughed
Wow.
because I got endurance. I
Wow.
got endurance, I got plenty of that. And I saw what they were trying to do. And I saw what the US was trying to do too. I saw the report by the Carter Center. It had nothing to do with our elections. It had nothing to do with all of the skullduggery which took place. It had nothing to do that the PPP came up with some statements of polls. And then when we started to show that those were fake statements of polls, they pulled back all those things and
Yep.
even took them off their website.
Yep. They did that.
Nothing,
Yes, they did
nothing
that.
of that was in the report. But you know what was in the report? Oh, Volda Lawrence was in the report. Volda Lawrence was in the report
Yep. We read
that
that.
she called her, the opposition murderers. Well, I said there's murderers, and murderers they are. I was at Shaka Blair. I was at so many other places
We
where they
lived through that
murdered
even.
young men.
We lived through that
So
era.
don't
The
tell me
troubles.
anything.
We lived through
They
it.
are murderers. And I said to them when I was attacked, and I never seen no women organization come out and defended me. When I was attacked by the PPP men and women, I didn't tell these people anything. I sat there for 3 days and said nothing. Even when my people were worried, I said, sticks and stones, sticks and stones.
Mm-hmm.
The man that doing all that he can do to turn Gaitsuko into a trash can right now, he was on top, Mr. Cessna, right?
Oh yes. He was a
Oh, he was
guardian.
on top of GCOM. You'd
Yep.
believe they own GCOM.
Yep.
You know how they were going on.
They had the own insurrection at GCOM.
Oh my gosh. Oh, it's a come see my live and make
Yep.
two different things.
Yep.
And so, Sherrod, I saw the move to attack me at every level and to have that spin off to my party. My party don't always get it right. My party, we try to be a godly party, right? And we try to do the best for our people, especially the disadvantaged people. And I felt, among other things in my life, that I needed to step down. I needed to step aside. I didn't say forever,
Mm-hmm.
but this season here is not my season for politics.
Mm-hmm.
Sometimes I see so many things happening, and I tell you, when y'all in that parliament, and I want to tell the driver, drive me and put me there.
Come true, Comrade Lawrence. Come true.
You hear me? And I see people talking all sorts of things. Some people who never lift a hand to help anybody in this country,
Mm-hmm.
but all of a sudden they have a voice. You see so many fake people. I tell you, you got more fake people than you got fake clothes and bags.
A season of Judases. That's what we got here.
Yes. And I sit and I watch them, and so I decide, you know what? I will put my party and my people first. This is not about me. I love serving people. I love my people. Don't care what they talk about me. They talk all kind of thing but me. But I laugh because once the story is not my story, Sherrod, I don't pick it up.
Mm-hmm. Mm-hmm.
I know who you're talking to. Perhaps the person got the same name like me. But them things don't bother me. I am a very happy soul in the Lord. So I want to put my people first. And as my family and my very close friends would say to me, especially my doctors, you know, you need to take time out. You need to take time out. I believe the happiest persons when I said I wasn't running were my doctors. I think were my doctors because they have been behind me for a very long time. And so I'm taking this time out. But I ain't going nowhere. I'm here to nurture and cajole and teach and share and give human service wherever I can and to whomever I can. I don't ask people to show me the party card. I don't give people a party form to pull up. I help people because I know when I do that, I am exercising here on earth one of the characteristics of the God in whom I believe in.
Amen to that.
I
Amen
don't
to
do it
that.
for anybody. I do it unto Him.
Amen to that. Very well, Comrade Lawrence. Very well. Folks, unfortunately, that's our program time. If you want more, you got to come in the ring tonight. We have Volda for dinner as well. Comrade Lawrence, it's been a privilege having you. It has been nothing short of a privilege having you today, and I'm looking forward to the rest of our discussion tonight.
Thank you, thank you, thank you.
Final words to
See
the
you
people.
later, Cover Duncan. See you later, everyone who is listening.
Fin-
Take good care of yourself.
awesome. We're going to see you later on this evening. Thanks for joining us, Comrade Lawrence. Folks, we did tell you all that Comrade Lawrence is one of our favorite folks. And apologies again for our false start. We hope that we've been able to give you guys back the time. Give back the time to y'all because we know some of y'all, even though y'all are partnering with us, we're giving y'all some quality program. That is what we are committed to, folks. Bringing credible and valid information to you guys. We ain't got time with the propaganda, people. We want to give you guys credible and valid information. Credible and valid information. And that is what we are about. Guys, if you want our programs, whether it's the podcast below the belt, whether it's in the ring, whether it's our website, to continue doing what we're doing, to continue to expand, we got more programs in the works for you guys. Y'all can get tired to see we face. We coming out. We out here, people. We want you guys to come on board and to partner with us. We got several platforms available. Of course, this thing don't run a watch, it takes something from us. It takes something from Comrade Lawrence to go out there and to keep fighting for Guyanese people. It takes something from us to keep on doing what we're doing. And folks, we're not asking y'all for $1 million. We say 5 US per month, 10, 15, 20. It will help us to expand. It will help us to do more of what we're doing. You see, we need more technical people behind the scenes so that we can not have all these little glitches that we had when we started. This is what we're doing, building out this program to your benefit. We want you guys to come on board with us. Again, we got several platforms available, like the Cash App, for instance. Our Cash App handle is the dollar sign or the dollar symbol in the ring 592. The dollar sign or the dollar symbol in the ring 592. That is our Cash App handle. We're available at PayPal. It's in the ring 592 at gmail.com. That's our PayPal email address. In the ring 592 at gmail.com. We're there by MMG too. That's the local Cash App people. We're there by the MMG. Our number there is 627-6963. That is the number there, 627-6963. And folks, we're not allergic to Western Union. You understand me? When we go there, we practice good social distance. But we ain't, you know, we ain't got a problem with them and they ain't got a problem with us. Western Union and MoneyGram. So we can be had there as well. And that MMG number, 627-6963. You can get us on WhatsApp there as well if you guys need any guidance. Thanks to all of you for joining the podcast today. You guys make the program special. I mean, Volda brings your own sweetness to the program, her own essence to the program, showing seasoning to the program, but it's you guys that make this program what it is. We want to see those shares. Tasha Silet. We want to see those emojis as well. We got some t-shirts for sale as well, guys. We got some t-shirts for sale. Two different branding, same for In the Ring or affiliate program. And we got two different sets of t-shirts for the In the Ring or affiliate program. And we're going to be telling you a little bit more about that as we go along. We're going to take some nice pictures and so on, put it up there. Folks, coming up, we're gonna be launching a virtual merch store coming up. We're gonna be launching our virtual merch store, but we want you guys to know a little bit more about that, because all of that are things that we are doing to help us to generate the kind of funding that we need to do the kinds of things that we got to do to make you guys proud. We are in the information age, guys, and we stay at the back. We out here. We out here. Share the live stream as you go. Good to see. Is it Lila Bihari? Vanessa, is it Cambert? And yep, it's Lal Bihari Ramkaran. Lal Bihari Ramkaran. Tasha, see that we see you there. Anissa Yearwood Shepherd. We see you, boo. Laverne, Haricharan, Kelman Prasad. We see you, Laverne. We see you. We out here. We know y'all out here too. We want to see those emojis, folks. And we want to see those shares because we want everybody to get the credible and valid information. Thanks for joining us below the belt today. Who vex, vex? Who vex, lose? That's how we roll in. Guys, and we're going to be back in the ring tonight. Comrade Volda and Lawrence is going to be back with us as well, and we getting into some more issues. We out here. It's such tonight. Good to see all of you folks. Stay safe out there. Continue to social distance. Continue to wear your mask. Continue to sanitize. Practice all the COVID-19 protocols that are in place for your health and your safety, people. Take it seriously. Take it very, very seriously. See you guys tonight in the ring, 8 p.m. Thanks for joining Below the Belt. Who vex lose? Stay safe, guys. Stay safe. And y'all remember to partner with me. And y'all remember to share the live stream too. And remember, we want to see the emojis. Stay safe, guys. Stay safe.